Imagine this. You're coughing up a storm, your throat feels like sandpaper, and your friend is staring at you from across the room, looking very concerned. Then they ask, is bronchitis contagious? Should I be worried? Well, today we're going to break it all down. We'll talk about what bronchitis actually is, whether or not you should be avoiding your sick coworker, and what you can do to stay healthy. So grab some tea, get comfy, and let's dive in. First things first, what exactly is bronchitis? It's an inflammation of the bronchial tubes, the airways that carry oxygen to your lungs. When these airways become irritated, they swell up and produce extra mucus. And that's why you end up with that deep, rattling cough. Bronchitis comes in two main types. Acute bronchitis. This is the more common type. It usually lasts for a few weeks and is often caused by a virus, kind of like a bad cold that settled in your lungs. Chronic bronchitis. This is a long-term condition that often affects smokers or people who are exposed to air pollution for extended periods. Okay, let's get straight to it. Is bronchitis contagious? The answer is sometimes. Acute bronchitis, the short-term kind, is usually caused by the same viruses that cause the common cold or flu. That means it can be contagious, especially in the first few days when symptoms are at their worst. It spreads the same way a cold does, through tiny droplets when you cough, sneeze, or even talk. If someone touches a contaminated surface, then touches their face, boom, they could get infected. But chronic bronchitis? That's not contagious. It's usually caused by long-term irritation from smoking, air pollution, or other environmental factors, not an infection. So, if someone has chronic bronchitis, you don't have to worry about catching it. Now let's talk about symptoms. How do you know if you or someone else has bronchitis? Common symptoms include a persistent cough that lingers for weeks, mucus production, sometimes clear, sometimes yellow or green, chest discomfort or tightness, fatigue and mild fever, shortness of breath, especially after activity. Acute bronchitis usually clears up on its own within 10 to 14 days, though the cough can stick around for weeks. But if symptoms last for months or keep coming back, it could be chronic bronchitis, which may need long-term management. So how can you protect yourself from bronchitis? Here are some simple but effective prevention tips. Wash your hands regularly. Germs spread easily through touch. Avoid close contact with sick people. If someone is coughing and sneezing, keep your distance. Boost your immune system. Get enough sleep, eat a balanced diet, and stay hydrated. Quit smoking. Smoking damages your airways and makes you more susceptible to bronchitis. Wear a mask in crowded places, especially during flu season or if air quality is poor. And if you already have bronchitis, don't worry. There are ways to recover faster and avoid spreading it. Rest and stay hydrated. Your body needs time to heal. Use a humidifier. Moist air can help loosen mucus and ease coughing. Drink warm fluids. Herbal teas, broths, and warm water with honey can soothe your throat. Avoid irritants. Stay away from smoke, dust, and strong fumes. Most cases of acute bronchitis don't require antibiotics because they're caused by viruses, not bacteria. Over-the-counter meds like cough syrups and pain relievers can help manage symptoms. However, if your cough lasts more than 3 weeks, you have a high fever, or you're coughing up blood, it's time to see a doctor. So, is bronchitis contagious? The bottom line, acute bronchitis can be contagious, but chronic bronchitis is not. If you're feeling sick, be kind to others. Cover your cough, wash your hands, and rest up. Have you ever had bronchitis? What helped you recover? Let me know in the comments. Don't forget to like and subscribe for more health tips. Stay safe and take care.